Friends, I want to read you a letter from a top hepatic surgeon in the United States at one of the top hospitals in the United States that I received. Dear Dr. Schultz, I performed many cholecystectomies, that's surgical removal of the gallbladder, on my patients during my professional career as a surgeon in the past. I felt that your treatment, specifically your liver and gallbladder flush, was quite harsh. But after reading about another doctor's positive experience with the liver and gallbladder flush, I decided to try it myself and on my wife, and subsequently I had my patients do it also. I am now convinced that your flush is not only safe and effective in cleansing the liver and gallbladder, the liver and even the entire body, resulting in energy and stamina galore. Considering the degenerative change in most people's present lifestyle in America, continued, considering the degenerative change in most people's present day lifestyle, I now find that I am in agreement with what you recommend, particularly your 5-day bowel detox and your 5-day liver detox. Secondly, in the past, I was often called by patients that would continue to have the same pain and complaints after I removed their gallbladder, particularly post-cholecystectomy biliary dyskinesia, which means after they had their gallbladder removed, they still had blockage of the bile and pain. And while we surgeons had never considered that there may also be stones in the liver, when surgeons do a cholecystectomy, a removal of the gallbladder, they render only a partial treatment, and nary a thought about might be leaving stones behind in the liver, sometimes causing a reoccurrence of the same problem. I guess we're going to go to a third one. Okay, and Part 3, since today's surgical removal of the stones is impossible when it's in the liver, why not recommend your non-invasive, painless liver flush to remove the stones both in the liver and the gallbladder and give the patient a total cure? The liver flush is a simple procedure that any patient can do for themselves at the advice of a healthcare provider. Your liver cleanse requires no hospitalization. The necessary ingredients are inexpensive and readily available, and the instructions are simple, and the procedure is not uncomfortable or distasteful. Again, this letter came from a top hepatic surgeon at a top hospital in America who now believes the best answer is not cutting out your gallbladder, not sticking any knives in you, but doing the Dr. Schultz 5-day liver and gallbladder cleanse. I rest my case.
Knjige doktora Ričarda Šulca, Lečenje neizlečivih bolesti, 30-dnevni program čišćenja organizma i druga izdanja, kao i biljne preparati i tinkture prema originalnim receptima doktora Šulca možete nabaviti putem telefona 063 732 7738 ili preko web sajta drschulz.com. Ukoliko želite da studirate prirodnu medicinu iz svog stana putem interneta, posetite sajt institutpm.com ili zakonizdravlja.com. Upis je otvoren tokom cele godine.